My plastic surgeon put my nipples back on wrong after my surgery. What? Today we're talking about all the things you've got wrong about breast lifts. And specifically, we're going to focus on the 5 most common ones I get asked about all the time, because it's these 5 areas that I see make women reconsider this procedure the most. And by the way, the 5th one is my favorite, so stick around. Before we get started, let's make sure we're all talking about the same thing. A breast lift is a surgical procedure where we reposition the breasts into a more youthful and elevated position on the chest. There are a lot of reasons as to why the breast can droop, and if you watched our previous videos on breast lifts, well then you're already an expert on this. So let's get into the first misconception about breast lifts. A breast lift can be done with minimal to no scarring. Yes and no. Like we talked about in our last video, a breast lift will have 3 types of scars depending on where your nipple sits on the chest. The trade-off in a breast lift is that we trade you a more youthful, lifted appearance of your breasts for some scars. The misconception is that these scars are terrible and won't look good. That is far from the truth. These incisions heal very well and will fade over time. And with proper scar management, starting with some silicone scar strips a few weeks after surgery, along with other options like microneedling or even laser treatments, these scars can fade very well. The next misconception is that many women think that they will lose sensation to their nipples after a breast lift. Now, while this is possible, it's a very small chance of that happening. Why? Because a breast lift involves mostly removing stretched skin and lifting the breast back up. This lifting procedure tends to preserve a lot of the breast tissue and thus allows us to decrease the risk of sensation loss. If there is a lot of tissue dissection or resection out towards the outsides of the breast, then the risk of losing sensation can go up, but still the risk is still pretty small. The third misconception is that women think their breasts are going to be smaller. In reality, your breasts are going to have the same amount of tissue as before, but just lifted in a more compacted shape that's going to give you a fuller look. Your breasts won't be involving so much of your chest as they did before when hanging low, so appearance-wise, your breasts may initially appear smaller to you, but in the end, they are relatively the same size, just lifted and more compact. The fourth thing people get wrong about breast lifts is that they need to get a breast implant along with their lift. This is absolutely not true. I have patients show up in my office after having consults at other offices and they've been told multiple times that they need a breast implant or they won't be happy with their results. Here's the thing, your breast lift is going to give you a fuller appearing breast and they will be more natural looking for sure without an implant. And if you don't want a breast implant, you shouldn't have to feel like it's required to get a great result. All a breast implant is going to do is fill out the upper pole of the breast, giving you a more augmented look. But if you don't want that look, then that's your choice and you can always go back later and have implants placed if you change your mind. The fifth misconception is my favorite because it shows up on a lot of my social media feeds and they're so much fun to watch. The statements usually go something like this from the creator. My plastic surgeon put my nipples back on wrong after my surgery. What? Inevitably, the creator will talk about how their nipple piercings used to be straight across, but now they point up and down. I can assure you that we don't remove your nipples during your surgery and then put them back on. Typically. Let me explain. If you have nipple piercings, then there is a technique of breast lift that uses the upper inner portion of the breast to support the blood supply to the nipple. But in order to use this technique, the nipple has to be rotated up rather than just shifted up. This results in your nipple piercing rotating about 90 degrees, giving the misconception that your nipples were taken off and then put back on wrong. However, there are times that we either plan to go straight ahead and remove your nipples to be put back on later during the surgery, or we have to remove them because they're turning blue due to a lack of blood supply. That's a whole different video and we'll get into that another day. If you want to learn more about how we handle possible breast lift complications, then you can watch this video right here. I'm Dr. Paul Pearce and I hope you learned something today. I'll see you on the next one.